Hello, I'm Steve Heward, the Public Information Officer for the Florida Department of Health in Sarasota County. Today is January 13th. To date, we've received 5,900 COVID-19 vaccines at the Florida Department of Health in Sarasota County, and we are currently distributing the last 1,000 doses that we just received. This morning, I'm joined by Chuck Henry, the Health Officer for Sarasota County. Chuck, would you like to talk to us a little bit about how we're doing the distribution for the last 1,000 doses that we received this week?
Sure, Steve, happy to do that. As you're well aware, as we ended the week last week, uncertain if we were going to receive any vaccine this week, but we learned on Monday afternoon that the state was able to move some things around and send us an additional 1,000 doses. So we rapidly made plans to get those out to our 1A target group. And I'll remind the viewers, the 1A target group that we're vaccinating right now is long-term care facility residents and staff at those facilities, those 65 and above, and our healthcare worker community, especially healthcare workers that have direct patient contact. So most of our focus so far with vaccine, the 5,900, the first 4,900 we received has mostly been focused on our 65 and above community, which is a really important group to vaccinate. So this week we shifted a little bit to healthcare workers in the community. That's going to be really important as we move forward because many in this healthcare community are going to help us vaccinate others in the community as more vaccines become available. And many of our local healthcare workers have signed up to receive vaccine directly when more vaccine is available.
Thanks for that, Chuck. You know, you also talked about the need for more people to be able to vaccinate in the community, and I think that's a good opportunity to talk about the second doses that people will be receiving here in a couple of weeks.
Sure, and there's been a lot of controversy or questions around second doses, and first, the current guidelines from CDC and the FDA tell us that we need to do second doses for Moderna and Pfizer. Moderna is the product we're currently using, and the second dose comes at 28 days or after. And right now we are moving forward with plans to deliver those doses. We understand that the second dose amounts were set aside by the federal government when they sent us the first doses. And so we expect those to begin arriving probably next week as the first groups that we vaccinated back on the 28th of December will be due for their second doses around the 26th of January. So we've asked people to watch our webpage. Some of those people that came through our first few clinics got appointment cards, but because we're moving our vaccine site away from the clinic and probably to a drive-through, we're asking people to watch our webpage for information on where those vaccine clinics will be. And we expect to be able to reach out to everyone through the email they used to register or through their phone number to let them know specifically what time on what days to come for their second doses.
Thanks for that, Chuck. You know, as we move forward, you discussed the fact that we'll be moving to a drive-through vaccination clinic setup. Would you like to talk about that a little bit?
Well, we haven't 100% nailed down the exact location. We're looking for the best location we can that's close to the interstate so that it allows as much access north and south in our county as possible. As our viewers are aware, there's 45 miles from north to south distance that residents have to travel depending on where they're at. And so it makes it a challenge. Right now, however, though, with the vaccine coming in limited amounts, the best move we can make to fairly distribute it is to try to be in that central location. Moving to a drive-through is beneficial for us because it presents additional safety elements for those being vaccinated. They don't have to get out of their car. They don't have to come into a building crowded and stand in line. And so I think that'll be really beneficial. It also provides more safety for my staff. Running 800 people through our building creates risk for our staff as well. So we're excited about moving to a drive-through. The only reason we haven't done that already is because of the low amount of vaccine and the logistics involved in setting up the drive-through. As more vaccine begins to arrive and as we begin to do second doses, I think that there'll be enough out there to support a drive-through.
Thanks for that, Chuck. Now, the final question for you this morning is, we've been talking for about 10 days now about a new scheduling system, appointment system for people in Sarasota County so that they can register and get in line for a vaccine, Could you talk to us about a little bit about what we're looking at and when we could maybe expect that?
Sure, and like many of our viewers, that can't come soon enough for me. And it's not that Eventbrite hasn't been very effective at scheduling people quickly, but we know that it's very frustrating because of the high demand on appointment slots and the low amount of vaccine, and the fact that people feel they need to be on every event trying to log in. So we're going to transition to a reservation system so that people can sign up and essentially get in the queue and know that eventually they'll get called. We hope to operate ours on a first in, first out kind of basis. So if we get 1,000 vaccines in, we take the first 1,000 people on the list and reach out to them, hopefully through technology, to schedule their appointments and get them in and get them vaccinated. And we'll continue through that list as more and more vaccines become available.
Chuck, thank you for all of that. You've given us some great information this morning, and I encourage our community to continue to look at SarasotaHealth.org to stay updated on what's going on with the COVID vaccines in the community. And with that, thank you for watching.